Good morning or good afternoon, and thank you for joining me today for my presentation or our presentation on catching up during COVID, supporting student immunization management using the SNAP Health Center. My name is Maryellen O'Keefe-Smith, and I am the electronic health records specialist for school health. Just a little housekeeping, if you have any questions, please use your question function during this presentation, and if time permits, at the end we will follow up with you. So for today's discussion, we will be focusing on these areas to make nursing practice more streamlined and to promote integration throughout your health office. There's a lot of information to cover, so we're going to get started quickly here. SNAP Health Center is a cloud-based solution specifically developed for nurses, by nurses, to help them manage planned and unplanned activities. To get us started off in the right direction, I have a really quick video that will kind of address the overall solution itself, and then we'll get a little bit more into the immunization portion of the modules. It's a 2-minute video. It's not working.
You should see a play button at the bottom left, Maryellen.
I do not see one on my screen. Hopefully I can find it. Here's what I'm going to do. I'm going to bring it back over, hit the play button.
SNAP Health Center is the leading school nurse electronic health record in the country, and school nurses can tell it was designed for nurses by nurses.
As a school nurse, you're entrusted with the care of our most precious resource, our children.
With SNAP, you can manage your daily activities, both planned and emergency. With SNAP, you have access to
the student's complete health record from a single screen, medication management, both scheduled and PRN, immunization history and management, individual and group screenings, walk-in visits, and so many more features that belong in a world-class EHR.
SNAP's powerful group processing capabilities allow you to process group events all at once. Things like securely emailing immunization compliance letters to parents, processing screening results, and documenting PRNs and standing orders, saving you hours and days of time.
With the SNAP Health Portal, you can keep your staff members and parents updated on critical student health information in real time.
SNAP can interface with your state immunization registry so you can have the most up-to-date vaccination history for all your students with the click of a button.
With a nearly unlimited number of reporting options, risk management, and health alerts, SNAP Health Center gives you real-time data analysis of all your student health activities.
This allows your administrators to manage the daily health of your students as well as react instantly to a potential health crisis.
When you are faced with a health crisis, SNAP's built-in monitoring and notification features can help you detect a health trend before an outbreak occurs and communicate immediately and securely with staff and local health officials.
In 45 states and 25 countries.
Serving over 10,000 nurses and over 5 million students.
SNAP Health Center is the leader for just one reason.
Because we never forget your #1 priority.
Okay, so that was just a quick overview on how the SNAP Health Center works. Just to reiterate a little bit about what you just saw, it is a FERPA and HIPAA compliant solution that simplifies K through 12 health clinic improvements for everyone on their health outcomes, from students, from the students' health outcomes, saves the school nurse a lot of time, and the liabilities. There are a lot of different tools within the solution. The Medicaid billing link, the health portal, which is a parent portal.
Can you share your slides, please?
So, sure what happened there. There we go.
Perfect, thank you.
Okay, sorry about that. Couple technical difficulties today. There's also some training, state reporting, and the immunization reporting that we're going to talk about a little bit more specifically. We all know the importance of, immunization and how, having a vaccination can really potentially help save a student's, life-threatening diseases and help those children before they become an issue for them. The role of the school nurse is extremely important in making the community safe for the children. And I have a few statistics here that I'd like to share with you before we get into a little bit more of the discussion on the immunization. So this data from the Commonwealth Fund shows that, this data is from March 13th of 2020, where the president declared the national emergency in response to the coronavirus. And as medical professionals, you all are familiar with the fact that significant disruption in the ability to provide routine and preventative care occurred during this time. Shortly after that, the CDC also came out with some guidelines on March 24th, but many of the states were already in lockdown or the schools were already closed. So doctors' offices prioritized visits for infants immunization, and many school-age children, they missed their scheduled physicals. This graph clearly shows the decrease in primary care visits for children between the ages of 3 and 17 during 2020. And it became this perfect storm of immunization disruption, meaning that thousands of students became off schedule for their immunizations. This is the data from the Commonwealth Fund that shows that pediatric practices saw significant reduction in students coming into clinics and seeing providers virtually, even well into December went unscheduled. Unlike other practices, specialists in pediatrics still haven't really, gotten back to that robust routine of having their practices in full swing yet. Families are delaying child visits. There's telecommunication that's happening. And school nurses who are used to seeing high rates of immunization compliance within their school systems may be struggling to even get sports physicals at this point. These disparities are even more obvious with some significant demographic challenges like race, ethnicity, and poverty status. So these all are having an impact on vaccine uptake. So I am pleased to be able to share with you today and bring to you Lauren, Romanauskas, who has recently left active school nursing to work with SNAP. She's well acquainted with the challenges of this post-pandemic for school nurses. And a little bit about her, she's a former middle school nurse. Lauren is uniquely positioned to speak about the challenges of immunization and compliance. And as she's chased many 7th graders for their DTaP boosters, she was also very active in practicing when the states went into the requiring the 2 doses of the varicella vaccine. She used SNAP significantly to track many of these second shots and to report back on how seamlessly these form letters that she could create for validating parent communication and things worked through the system. So Lauren, thank you so much for joining us today. Really appreciate you spending the time to go over this.
Thank you. I'm thrilled to be here. Very excited.
So let's just jump right into this. So, you know, I'm just kind of curious to start out this and to start out our whole conversation a little bit about, you know, my understanding from working with you and with professional software for nurses is the just one component, you know, can really make up a whole. But for those who may have never seen SNAP before, on a higher level overview, the immunization management and how it's structured into the software and how that really differentiates the software system.
Absolutely. I used SNAP for 10 years before coming to work for the company. So I like to think of SNAP as my nursing security blanket. It's always making sure that I'm able to prove my nursing legally and that it helps me follow that old nursing axiom, if it's not documented, it's not done. So on the next slide, here's a student who is non-compliant per New Hampshire state guidelines because he's missing his second dose of the varicella vaccine. The cool thing is SNAP will live check your immunization compliance, so you can be 100% sure a student is compliant before they even enroll in your school, even if they're on a catch-up schedule. So you can see that a student's got what they need to make sure that their immunizations meet state guidelines. And if you go on to the next slide, you can see that the nurse has entered that second dose of the varicella immunization and the student has now become compliant. On that right side is that SNAP live checking based on every possible scenario so that you can see that those immunizations meet the minimum mandatory requirements. On an annual basis, SNAP's informatics nursing team does a deep dive to do a complete analysis to see if any new state vaccine requirements have changed. And there's even a place to track exemptions and titers if your state has a medical exemption or a religious exemption. For example, my state had a change to the polio vaccination this year, and SNAP made it so easy to deal with all those older combination vaccines that I didn't really know what they were. I spent some time on the phone with one of our nursing help specialists, and we really worked to figure out a workaround for those state guidelines so that our repeat ninth graders, so those kids who got retained a year, our state uses grade guidelines to set those immunization requirements instead of birthdays. So if you're a repeat ninth grader, you may have been compliant last year, but based on those new polio requirements this year, you're not anymore. So we had to put in a workaround that SNAP made so easy for us. It saved me so much time.
Well, that's great. I really appreciate you going through this. I really would like to at this time kind of jump in and address the new COVID vaccine approvals, because COVID vaccinations are going, well, I shouldn't say going to be available. I think they are now available for children.
Right now.
Yeah, right now, as we've seen in the news. And so I'd really like to know how SNAP really can help track new pediatric COVID vaccinations.
Absolutely. SNAP has been prepared to track pediatric COVID vaccinations from the very beginning. We've been tracking COVID vaccinations all along. If you go to the next slide, you can already see that we have a rigorous COVID-19 data collection already in place for our students 12 and over, because those kids have been being vaccinated for a while. So adding pediatric vaccinations will be a SNAP. We've actually been working with the CDC right now to create specific CVX codes for those new smaller pediatric doses, and we're ready to roll those out state by state once we have the okay over the next, hopefully, few days as shots starting to come into arms. And parents can log into our parent health portal and upload copies of their children's vaccine cards, and nurses can directly enter those immunizations into those student records. Because COVID-19 vaccinations aren't required at this time, SNAP is smart enough to know that if a child is still considered compliant, even if they haven't completed those COVID-19 series. However, if a state mandates those COVID vaccines, SNAP will be ready to put those compliance checks into place so that nurses will be able to run all the different reports and things that they need to see who's vaccinated in schools. Even now, you can run compliance checks if you have a question of whether or not a student needs to quarantine. If your state has a vaccination requirement to opt out of quarantine, you can run reporting lists to see who's vaccinated in your schools for COVID, so that it makes figuring out who needs to quarantine or not very, very simple.
And just as a quick follow-up to the vaccinations on COVID, so once children start to get that initial shot, will the parents, is there a way for you to be able to remind them that in 28 days, I believe it is, they need to get that additional shot?
Absolutely. If you go on to the next slide, this is our optional health portal add-on. And parents can see what they have in place for vaccinations uploaded already with the school, and nurses can send out secure emails to let parents know, hey, by the way, your next dose is due, get ready for your shot. And the best part is it's all automated. So it's really easy to get those reminders. I know I have to remember my own daughter's second dosage is, her second shot is coming up on the 7th. So I already got my little notice. So.
Well, that's really great. And I'm sure this is very helpful, especially since, there's been a lot of students who have been missing so many of the required immunizations. I think I saw a report from the CDC that said that with that gap from COVID-19, some vaccinations are really, showing a big downturn. The Tdap was over 17%, the HPV was 18%. And what's even a little more concerning is something like measles, that's 18.5%. So my next question really becomes, how does SNAP really help encourage students to get their required vaccinations?
Thanks, Maryellen. If you go on to the next slide, you can see that SNAP really has 3 components of how it tracks and helps nurses work with families to make sure that students get the required immunizations. My school has always had really, really high rates of compliance. I'm talking like 98, 99%. Like, we had all the certificates lined up on our wall from the state. However, after we came back from hybrid learning and I ran those reports for compliance for Tdap boosters, we were at like 68% compliance. About sweating when I had my immunization report due in November. So I can't even imagine backtracking all those non-compliant students and reaching out to those families without SNAP to help me. So I'll show you on the next slide. So this is SNAP's group processing for immunizations and how to run these immunization compliance reports. One of my favorite features within SNAP is it actually allows you to age up students in grades so that I could convert all my 6th graders into 7th graders for just a moment. So I could fill out and run reports for all those missing 7th grade immunizations like Tdap and Menactra. And I would send out those mailings to those 6th grade parents to encourage them to get their immunizations done even before school started in the fall. So that would really help with my data entry and making sure those students were compliant even before they became non-compliant. So it really did make it one-click simple to run all of these reports.
So compliance reports, my question is really about, student immunization form letters or anything that you can create. It looks like on this slide.
Yep, absolutely. So I had really customized form letters that I created within SNAP, and SNAP's designed to make it really easy to plug those individual student information into those letters. So you're addressing that student by name in that letter. You're putting in the parent and teacher names and the date of birth so that it becomes a legal record of the student's immunizations that they can actually take to the doctor with them or to the public health clinic that's actually going to do the immunizations, so that those providers know what you have on file to make sure that those students don't get double dosed or they don't actually miss the dose of the immunization that they need. And honestly, my letters were so customized that as you got closer to the exclusion date, the word exclusion got bigger and bigger and bigger, and, and my letters got more and more demanding. So by November, you're like, you've been told 3 or 4 times by now. So it's really easy for those parents to communicate back to us at the school once they get those immunizations in hand.
Well, that was my next kind of follow-up question was going to be, once the parents and guardians get these letters, how easy is it to communicate back to the school?
Oh, super easy. If you go to the next slide, we've got in here a picture of our parent health portal where you can see the nurse has sent out a letter and the parents actually can sign that letter that they've received that letter, and then they can upload copies of their students' immunizations. It's paperless and it's so easy. And it becomes actually a nurse's legal nursing signature, their legal documentation that this has been approved. It becomes HIPAA and FERPA compliant too.
That's great. I mean, while SNAP can really do it all for everybody, I mean, and I know a lot about this from having worked with the team over there. But my next question really is kind of going back and jumping back into that COVID registration and how does this whole registration really work with SNAP, and can you help kind of explain the availability on what's out there and how it comes online?
Oh, absolutely. So SNAP has this really, really nifty feature called ImLink, and in states where it's available, those are the blue states, they can actually group process their students and download immunizations for all the students in the school with just one mouse click. And you can do that individually too, or in smaller groups too, if you know that you have students who are available within that ImLink system. If you don't see your state listed right now, we urge you as nurses to reach out to the state registry. I know that in my own state of New Hampshire, we didn't have a vaccine registry until us nurses were very, very proactive with asking for it and begging for it. And hopefully that will come online soon within the ability to link with SNAP. So the more and more nurses that reach out to the state registries, the more powerful ImLink can be for us as nurses. But those pediatric vaccines, they're there sitting in ImLink, which is awesome.
Well, that's really a great tool to have available. And I know the nurses struggle to manage all the challenges of their workflow, not to mention, contacting with parents, extra meetings, phone calls. Now they've got vaccines and mask mandates. I can't even say that. So
it's hard to say that fast.
Mask mandates. So how can SNAP really help simplify this workflow for all of the nurses?
Mm-hmm. Well, SNAP has always made my workflow so much easier, and it's even saved my district money. If you go on to the next slide, you can see that a nurse is putting a parent phone call into the system. These types of non-encounter activities are great for nurses to be able to track the number of times that they've reached out to a parent or completed a specific task in a day. I used to play a high-low game with my principal every day on how many parent phone calls I make. He'd stop by my office in the afternoon and be like, Lauren, about 10 or so? And I'd be like, no, try like 50. So it's really, really easy to keep track of the number of phone calls that you'd make. In this visit log, you see that a nurse is able to track their workflow and document the time while keeping a very accurate record of the phone calls they make. So not only does that documentation show up on the day that you did it in that visit log screen, but it also links with the individual student's record too. So you can scroll down and actually tell a parent, oh no, on this day, I called you 3 times and your voicemail was full. And then I can also say I sent out this letter or that letter. I just had a situation in a meeting with a parent where she insisted that she had absolutely no idea that her child was non-compliant, but I was able to use SNAP to review all of my workflow history with that particular student and say, nope, you've actually been called multiple times. And I was even able to pull up the scanned copy of the certified mail receipt that she'd signed. So on the upside, we were able to get that particular student vaccinated the next day at the public health clinic. But without my SNAP documentation, I'd have just been relying on my own memory or that parent's honesty. So
Yeah, well, that's a real benefit, isn't it, to doing that? So I'm going to just move on to our next question as we're starting to run out of a little time here. But, you know, schools are planning vaccination clinics, right, to help students get up on this COVID-19 vaccine. So I'm just wondering what SNAP can really do to help, you know, with this age range of kids from 5 to 11 and any clinics that they're planning.
Absolutely. If you go on to the next slide, SNAP has a really, really powerful group processing feature that allows you to group process all these immunizations all at once. So if you have an immunization clinic at your school, you can move over and select the names of the students who attended that immunization clinic and just add that immunization to their records. Makes it really, really easy and simple.
Okay, that's great. So, you know, as we're coming to the end here of our conversation, I just want to bring this back around to talking a little bit about our relationship and partnership with PSNI and SNAP Health Center. I mean, School Health is a dedicated national sales team that works pretty closely with the counterparts over there to be able to help, you know, implement a health record system. So we also can help our customers leverage any existing contracts or buying groups that are out there that can make the whole process of this implementation a little bit easier for them. I myself am the electronic health record specialist, and so I tend to get involved with a lot of these customers and helping out to make sure that they're getting everything that they need. And so you have access to that as well. And then online, we do have a online area where you can go. And if you want more information, if you want to get a demonstration that's really specifically targeted towards your group, your organization, your school district, you can request a consultation and we'll follow up with you on that. So I know we went through a ton of information today, but I just want to say thank you to everybody who's out there. I think we may have a few minutes to take 1 or 2 questions. Brian?
Yeah, we do. And we do have some questions that have come in. I would also like to introduce Christine Drucker, who is on the line with us. Christine has over 13 years of experience and has really become a subject matter expert on K through 12 electronic health record systems. And so we welcome you, Christine. Thank you for bringing your expertise to the panel. The first question that we have here is SNAP able to track COVID-19 vaccine mandates for teachers if that is requested by a school district?
Well, first, thank you, Maryellen, and thank you, Lauren, for sharing your personal experiences as a school nurse. And Lauren, would you mind answering that question regarding vaccine mandates for staff?
Oh, no, definitely. So staff can be entered just like students into SNAP, and then you can very easily input those immunizations. You can even use a group process if you have an immunization clinic at your school, just like a flu shot clinic. And then you can very easily see which teachers have their immunizations on file and which ones you still need to get data from. So just like students, teachers can be put into SNAP as well.
And to add to that, you can also import teachers into SNAP, so that way you're not having to hand enter them.
Oh, absolutely. The great part about SNAP is that it links with your school information system so that students' conditions and alerts can pop right up, and teachers can have access to the information that they need for the students in their classroom, as well as what you, the nurse, want to keep private and separate for you, so that those confidential alerts aren't necessarily viewed by teachers too.
Wonderful. Thank you both for that helpful information. We'll take one quick question here remaining. It looks like we are about out of time. We talk about the link between SNAP and the state registry. We've got a question here that asks if that happens automatically or if you have to sync your SNAP software and the state registry student by student.
I'll take that one. So with the SNAP-M link, you're able to sync either individual students or you can sync groups of students. The nurse would be able to decide if they want to maybe sync the whole entire school, but if it's a large school like a high school and it has 1,000 students, they might want to sync by grade. So they have those options depending on how much data is being transferred.
Okay, wonderful. Thank you, Christine. We are out of time, unfortunately. I do see that we have questions in from Donna and Stephanie. Donna and Stephanie, please know we'll get back to you with answers for your questions. Maryellen, if you'd like to go ahead and wrap it up.
Sure. I just want to say again, thank you all for joining us today. Lauren, Christine, I really appreciate your time and expertise. And Lauren, especially you sharing all of your stories as a school nurse using this system. I think it's great. It's a really great. Again, School Health has the ability to help you in any way possible with this electronic health record. So please feel free to reach out to us, and we'll be happy to start a plan and work through any kind of implementation that you need. Thank you so much.
Thank you, Maryellen.
Thank you.